Hello, my name is Catherine Lutz, and tomorrow I will be conducting a home exercise program for a patient who is 1 week post-operative from a right total hip arthroplasty procedure. Total hip arthroplasty is a surgical intervention commonly used in management of hip osteoarthritis or hip fractures. Hip osteoarthritis is the most common arthritic disease of the hip joint. The etiology may be the aging process, joint trauma, repetitive abnormal stresses, obesity, hip developmental disorders, or disease. Some degenerative changes that may occur in the hip joint include articular cartilage breakdown, capsule fibrosis, and osteophyte formation. The main goals of hip arthroplasty surgery and postoperative management are to, number 1, provide the patient with a pain-free hip, number 2, a stable joint for lower extremity weight bearing and ambulation, and number 3, adequate range of motion and strength of the lower extremity for functional activities. Some contraindications to a total hip arthroplasty procedure include joint infections, chronic osteomyelitis, paralysis of muscles surrounding the hip joint, and young patients who are most likely to participate in a high-demand activity. The American Academy of Orthopedic Surgeons value for hip joint range of motion are flexion 0 to 120 degrees, hip extension 0 to 20 degrees, hip abduction 0 to 40 degrees, hip adduction 0 to 20 degrees, and hip external and internal rotation 0 to 45 degrees. The precautions for my patient's condition are he is partial weight bearing status, he must avoid hip flexion greater than 90 degrees, he must avoid hip adduction beyond neutral, and he must avoid internal rotation beyond neutral. He must also avoid all ADL or activities of daily living, which may include these restricted movements. I will educate the patient and his caregiver on all the precautions to his procedure. A little bit about my patient. He is a 72-year-old male who currently requires minimal assistance with all mobility activities. He also currently uses a rolling walker assistive device, and he is partial weight bearing status. He has stated his living environment consists of no stairs, and he lives with his 45-year-old daughter, who is his primary caregiver. I have previously evaluated the patient 3 days ago, and his surgical procedure and pathology fall under preferred practice pattern 4H, which is impaired joint mobility, motor function, muscle performance, and range of motion associated with joint arthroplasty. Hip abduction and external rotation active range of motion are hypomobile from the AAOS normal range of motion. Hip abduction was 25 degrees and hip external rotation was 20 degrees. I have also performed gait training and mobility with the patient, so he is familiar with transferring from supine to sit and from sit to stand, and with walking with his assistive device. I have created a home exercise program for the patient to perform twice a day for the next 3 weeks. I have also included educational instructions for his daughter, who is his primary caregiver, on how to assist the patient with mobility, positioning, in his home exercise program. Tomorrow I'm going to instruct him on the home exercise program, and I'm going to record it because he's previously stated he prefers to learn visually and by active participation. So a little bit about my home exercise program. The first exercise I've chosen to include is supine hip abduction or windmill exercise. The rationale behind including this exercise is to regain strength and muscle endurance in the hip abductor muscles. Research has shown this exercise produced a clinically significant value on several outcome measure scales in increasing hip strength to reduce pain and muscle imbalance following a total hip replacement. My second exercise is supine knee bends or heel slides. The rationale behind this exercise is studies have shown it is the most often initiated exercise in the hospital setting after a THA procedure, and it's continued in the home setting following discharge. Supine heel slides restore mobility and control of the operated hip. The short lever arm places lower loads on the surgical site than a long moment arm exercise does. My third exercise in the home exercise program is supine leg raises or straight leg raises. The rationale behind this exercise is that it has shown to be effective in regaining range of motion and muscle control post-operative, and it is commonly prescribed for post-op total hip replacement patients. I have chosen a light to moderate dosage for each exercise, specifically 2 sets of 12 reps to be performed twice a day. The patient will be encouraged to increase dosage to fatigue if it becomes relatively easier for him during his progression in his home exercise program in the next 3 weeks.
Good afternoon, Mr. Frost. How are you today?
Good.
Good. All right. So your total hip replacement, right total hip replacement surgery was 1 week ago, and you've been doing pretty good in therapy. You've met all your goals so far. So I think it's time to discharge you with the home exercise program.
Okay.
So today I have a video set up where I'm going to record us, and that way you'll have the exercises there for you to instruct yourself when you're at home. Is that all right?
Mm-hmm.
Okay. All right, so before we begin, I'd like to go over your hip precautions again. And you have 3 hip precautions. Number 1, do not cross your legs. You want to be sure, you don't want to bring this right leg over past midline. You want to be sure to watch for that when you're getting out of bed, because that's a common way that people break it. Number 2, you want to be sure to keep your right leg, your surgical leg, it's in a straight line. You want to keep your knee straight and your toe straight. You don't want to rotate it in or turn it inwards towards your body.
Okay.
Okay? That's another one that's commonly broke when you're getting out of bed, so be sure to watch that and keep that straight.
Okay.
All right, your third precaution is you don't want to bend forward past 90. 90 degrees is the usual measurement that people are when they're sitting in a chair. That's about 90. You want to, if you're sitting in a chair, have that leg kicked out so you're not at 90 degrees, and you don't want to do any activities like reaching forward to tie your shoe or bending down to pick something up.
Okay.
All right, all these hip precautions are there to prevent your hip from popping out or dislocating.
Okay.
So we want to prevent that. All right, so if you don't mind repeating those back to me so I can make sure I explain them right to you.
First, I don't want my leg to go past across. I don't want to cross my legs, is what you said?
That's right.
The second one you said you want me to keep my knee and my toe straight.
Yes.
And not bring that toe towards that side.
That's right.
And then lastly, you said you don't want me to bring my hip past 90 degrees.
Right.
So you don't want me to bend over too much. And when I sit, I need to keep my leg further out.
That's perfect. You got them exactly right. All right, so I think now we can begin our home exercise program. I'm going to teach you 3 exercises, and I want you to perform all 3 of these exercises twice daily. That means you can do them early in the morning, one in the early evening, or late afternoon, late evening, however you prefer. Just be sure to do them twice a day.
Okay.
All right, so our first one we have is called windmills, or another name for it is hip abduction, but I like to call them hip windmills because it's similar to a windmill motion.
Okay.
So what you're going to do is you're going to bring that right surgical leg, I'm going to show you first. So you bring that right surgical leg out away from your body as far as you can, and then you're going to bring it back in. It's as simple as it is, and you're going to do this 12 times, and you're going to do 2 sets with a 1-minute rest in between. So if you want to do that, I'll make sure I'm here to help you. And your caregiver, I'm going to instruct on your video if your caregiver needs to assist you in your exercises. She should do, which is your daughter, you said, she should do what I'm going to do for you. So if you need assistance, I'm going to hold here underneath your heel, and I'm going to grab underneath your knee, and I'm just going to help you glide over. Okay, and then back is 1.
Okay.
Okay.
So out and in is 1, and I do 12.
That's right.
There's a certain speed I have to do it?
Just slow and
Or can I
controlled
just-
movements.
Okay.
And you want to make sure when you're doing this, when you're coming back in, keep that kneecap straight. Don't let that kneecap roll back in when you're coming back in towards your body, because that'll break what?
That will break my precautions.
That's right. All right, good job. And how often did I say to do that exercise? Just make
Twice
sure
a
I told you
day.
right? That's right. Okay, and now we're going to do knee bends. Or another name for this is heel slides. And for this one, I'm going to need you to take your shoes off. You want me to take your shoes off for you?
Sure.
Okay, so you want to be sure to bend up your non-surgical leg up and with your heel flat. There you go. And that just makes it more comfortable. Now what I want you to do is bend this surgical leg up towards your body as far as you can, keeping your heel on the table. Yeah, that's good. Okay, and I want you to do this 12 times. And rest for 1 minute and then do 12 more. So 2 sets of 12. It's like sound like a fart. Good job. And your caregiver, if you need help, you're doing pretty good on your own, but if this becomes painful, have your caregiver once again grab underneath your knee and your heel right here and just slowly guide you up, but keeping that heel on the table. And you want to make sure that you're not breaking that hip precaution and going past 90. And you want to make sure that your caregiver isn't forcing your knee up or doing all the work for you.
Okay.
Okay? So, can you tell me, how many sets did I tell you to do? Reps?
12 reps.
That's right. And how many sets?
2.
That's right. That's right. Make sure I told you right. And a rest of about a minute is usually pretty good in between there, but just so you don't get too fatigued. All right, so our third exercise is straight leg raise, and for this one, keep moving around here. You're going to just you're gonna tighten up your thigh muscle, okay? And now you're just gonna bring this leg up off the table about 1 to 2 inches. That's perfect. And back down slow. Slow and controlled movements is what we're looking for. That's good. And for this one, we're gonna same thing. We're gonna do 12 times, 2 sets.
Okay.
Good job. And your caregiver also for this one, I want her to place her hand here underneath your heel, then underneath the knee, and if it becomes too tiresome for you, and she can just help guide that up a little bit. But you're doing pretty good.
12.
That's all right. Before we begin the caregiver recording of how to assist you, I want to review your home exercise program one more time, and I'm going to check the understanding and make sure I explain that correctly to you.
Okay. First, we did the windmill, which I moved my leg out like this, and then I bring it back here. And then secondly, we did the leg raise, the straight leg raise, which I bring my leg up a few inches and then back down.
And how long are you supposed to hold it at the top?
12 seconds.
That's right.
And next, I brought my leg up like this, and then I did, you call them heel slides, and I slide my heel up like this, and then back down. And I do that 12 times as well.
That's right. And so, how many sets did I?
You said 12 set. No, you said 2 sets of 12 reps.
That's right. Very, very correct. And how often do I want you to do your home exercise program?
I should do them twice a day.
That's right. All right. So the reason I'm having you do those 3 exercises is because those have shown to be really effective in improving your mobility of your surgical leg, and they help to regain muscle strength and prevent muscle loss strength in that surgical side. And it's really important to be sure to do that home exercise program, which I know you're great, so you'll do it.
Awesome.
All right, so now I want to go state your hip precautions one more time for your caregiver. Number 1 is do not bend beyond 90. So when you're assisting your father, make sure that when he's getting up or out of bed or sitting in a chair that he's not at 90 degrees, which is a common degree when you're sitting in a chair. kicking that leg, that surgical leg out in front. Adjust my video. Kicking that surgical leg out in front when you stand up, when you sit down, that will help prevent that. Number 2, when your father's getting out of bed, that leg likes to sometimes try to turn inwards, so the kneecap comes in. That is breaking the hip precaution of internal rotation, which is just the legs just rotating inwards. You want to try to prevent that, so keep that leg straight, knee straight, and foot in line. And number 3 is we want to make sure not to cross that surgical leg past midline. So you want to make sure not to ever let him have his legs crossed. If you want to put some pillows or a wedge in between the legs, that can help prevent that if you're worried about it happening at night, which it's probably pretty important to just go ahead and have that pillow there. Also, getting out of bed, people like to try to cross to get out. Make sure that doesn't happen. And Mr. Frost is really good at honoring his hip precautions, so I know that you won't have any problems helping him enforce those. So, all right, so in the beginning of this home exercise program for the caregiver instructions, we're going to do from lying to sitting. Mr. Frost is minimal assist, which means that you really don't have to do a whole lot. You're there for more of a contact guarding or assistance if needed. So if you want to go ahead and sit up for me as best you can, and I'm here to assist you. Perfect. And the biggest thing to look for when you're sitting up is just making sure you're not breaking the 90, which he's not because he's staying back in an incline. All right, so now if you want to go ahead and sit to the edge of the bed, making sure, perfect, didn't bring that knee inwards, okay? And now the next thing to do is Mr. Frost requires a assistive device of a rolling walker. So when he goes to get out of bed, always, always, always have the walker. We don't want walking around, jumping, or anything like that. We want to make sure we're always using the walker. So that's something that you can definitely enforce. So put that walker in front. And so when you go to get off the bed, Mr. Frost already is well aware how to do this, but keep the one hand on the bed, one hand on the walker, keeping that surgical leg kicked out so you're not breaking the hip precaution. And I like to stand here and I like to count so you're both on the same page and one's not trying to hurry up and go and the other one knows what's going on. So just on the count of 3, we're going to stand. 1, 2, 3. Great job. Okay, so now for gait training, I've already fix that. Okay, I've already instructed Mr. Frost on how to walk, but for when he is walking, it's best to stand on his surgical side, and you're there once again for contact guarding or minimal assist, just in case he gets weak or needs to sit down really quick in a chair. All right, I'm going to go ahead and sit back down for me. So on this, make sure that he backs up and can feel the bed all the way behind his knees, so he knows where he's at in space. There you go. And then reach back with one hand, keep that leg kicked out in front of you, and go ahead and sit down. Perfect. All right, and that's it for the caregiver instruction. And I had a pleasure working with you, and I hope you have a good week.